Hello, my name is Obianuju Ogbonnia Ok, DMP student at Maryville University, and I will be presenting my DMP project, the implementation of non-pharmacological intervention to manage behavioral and psychological symptoms in dementia. Before I start, I would like to acknowledge my DMP project chair, Dr. Rita Wonderlake, Catherine Macaulay School of Nursing, for her constructive feedback and undeniable professionalism has contributed to the success of this journey. I just want to let you know that you're so much appreciated. Also, Myrtle E. and L. Walker, College of Health Professions, Maryville University. Second reader, Dr. Jennifer Bromwood, and my community member, Dr. Mark Gustin. Background and significance of this project. Antipsychotic medications were originally prescribed for the treatment of psychotic symptoms in individuals with dementia. However, providers expanded the use of this medication for psychological symptoms for people with dementia, despite the FDA warning, black box warning for this medication. And currently, dementia has no cure, but rather using this antipsychotic medication for elderly individual who has only dementia diagnosis predisposes them to more adverse reaction ranging from falls, cardiac issue, outbursts, negative impact on their outcomes, and declines in their quality of life, and can also lead to death. Hence, this project. The purpose and aim of this project is that the aim is that to implement a non-pharmacological intervention using a practice guideline set by Alzheimer's Association to see if it will lessen the BPSD symptoms and at the same time lead to the reduction in excessive use of antipsychotic medication to treat dementia. And the purpose is to determine if after this practice guideline is introduced, whether there will be a change based on the practice guideline to use this as the first line of treatment. So to start this project, we went for literature review. And in the literature review, we used the search in the Ovid synthesis with the Medline and Ovid database and Maryville Library for advanced discovery search features. Some of the keywords that we use are BPSD management, dementia management, treatment guidelines, non-pharmacological interventions, atypical antipsychotic, and negative impacts. And the period that we looked into is 2012 through 2024. So the literatures gathered were, grouped into three themes. And the three themes first is the atypical antipsychotic medication use, the risk associated with it. The second was the barriers, to effective non-pharmacological intervention, to manage the BPSD. And the third theme was non-pharmacological intervention with outcomes in managing, BPSD. So, the theoretical framework that guided this project is the theory of plant behavior, originated by Isaac Azim, was, best fitted for this project. And, he believed that, the volitional behavior is determined by, the intention, and, it illuminates how people, how people's behavior, you know, controls their action. So this, and the action is controlled based on their belief, and that leads to how they can be able to, take care of others. So it provided a value of understanding, for the fact influencing how some healthcare providers are able to take care of their patient. So it's well suited for the project. So the methods that we use for the project, this project is, a quality improvement initiation that uses quantitative exploratory design through retrospective chart review. So what we did is that the participants will not be engaged with anything, but rather a chart review. So there will be education of the, with the practice guideline to staff of the selected facility, and then be able to implement it and then check pre, and the post intervention, which covers 3 months before the implementation date and 3 months after the implementation date, to now compare, to see if there are any changes. And it was done on 40 charts review on patients who are 60 years and above and has only dementia as their psychiatric diagnosis. So the design that we used, like I said, it was it used a design that was just meant to review the charts, and we used a facility that was federally, qualified to be able to use to be able to conduct this intervention. It was done in the of eastern part of America. So we did our inclusion and exclusion criteria. The inclusion criteria was that for a participant to be qualified, they must be 60 years and above, and they must have only the dementia as a psychiatric diagnosis. At the same time, they must have been in the facility within the period of this review. That's 3 months before the implementation and 3 months after the implementation. And this, inclusion and exclusion method goes until 40 charts are reviewed. So the sample, like I said, was for 40 electronic medical record to be reviewed on patients who are 60 years and above with just diagnosis of dementia. So a sequential inclusion and exclusion, process continues until 40, charts are obtained for the project. So we did that and the data analysis. So we extracted the information from the electronic medical record of this individual selected. So, and we looked into the items about the agitation event and the use of PRN antipsychotic medication. And at the same time, we use the data that we are collected. we use the Wisconsin signed peer test to perform because it's a reliable method to use for our analysis. So at the same time, we also use the p-value for both comparisons, of of the data, and then which were less than 0.05. The result of the project, and shows that there is there is a significant improvement in managing agitation events post education, demonstrating the effectiveness of non-pharmacological intervention for patients who have behavioral and psychological symptoms in dementia. And the decrease, in the significant decrease in the PRN medication used highlighted the importance, the role of reducing reliance on so much medication. And it underscores the potential of individualized non-pharmacological strategy for management of behavioral and psychological symptoms in dementia. Yes, despite the strength of this project, there were also a lot of limitations. Some of the limitations were like the sample size, which was small, so it will affect the potential of generalizing the for a broader practice and or a broader population. Also, the demographics, because we have 55% of white and 45% of other ethnic group. So it might not show exactly how it works. So it's a kind of limitation because of when we do in a generalized population to be able to cover every ethnicity. So also selection bias. The electronic medical record data may have captured, you know, the population, missing those who, you know, haven't interacted with the healthcare system. Also, data reliability, self-reported and caregivers documentation may introduce bias and outcome. Also, the study design factors affected, will be affecting the robustness of this uh, result being repeated, being repeated, repeatability for, and also for, a strong conclusion. And again, absence of, control group may have limits, the ability to definitely see this is what the outcome always will be. And at the same time, the long-term evaluation, will further, explore the required, to be able to sustain, the benefits of this project. Discussion. In my discussion, in the things that we found, yes, there were, unexpected success of this study with a significant pre, to post test changes in exceeding the expectation. Yes, we anticipate that there will, it will work because it's a like more of evidence-based practice. But then it surpassed the expectation, highlighting that staff, practice adherence to the use of non-pharmacological, intervention as the first line of treatment to manage BPSD. Again, it's using the Wilkinson sign rank test, shows significant reduction, with the scores of, showing us that significance of less than 0.001 and moving in the right direction. So educational intervention was significantly, important in reducing the symptoms and reducing the excessive use of antipsychotic medication. And, at the same time, empowering staff with training, boost staff, competency, and hence, improving patient care. So, non-pharmacological approach aligns with research advocating less reliance on, antipsychotic medication. And at the same time, we noted that there is a shift in moving from medication focus to what? To care for dementia patients. And you know what? Post implementation challenges such as the COVID-19 during outbreak during this period of implementation shows there are staff shortages, but the staff, they came together and they overcame through interdisciplinary collaboration, which is very good. And despite all these strengths that this project has shown, I still say that the small size sample and potential buyers may have a little issue to deal with the validity of the project. The implication of this project to practice. Yes, the DMP project, it will establish a framework for similar studies to be used, in care for other setting. Yes, can be an evidence-based practice that is, standard to use. It will also encourage and build up practitioners' skills by integrating it into standard of care practice for managing behavioral and psychological symptoms in dementia. At the same time, it will, improve our skills because if this is a training module, it could become, part of the required certification for caregivers, and others, healthcare staff. So it also provides safe environment and reduces, stress on caregivers. In conclusion, I would say that non-pharmacological intervention for managing behavioral and psychological intervention, right? Psychological symptoms in dementia has an effective, impact, and it worked, by reducing, this like the agitation that this resident, shows, and at the same time decreases the excessive antipsychotic medications, the PRN, and which was shown and validated, in this strategy that the primary approach for dementia treatment would be to use the non-pharmacological intervention to take care of them. It also highlights the importance of equipping practitioners with the right tool, and knowledge with significantly, enhancing patient care and, have excellent outcome. The widespread adoption of this, implementation will show a successful, practice and will be crucial, for improving safety and quality of life for individuals with dementia, and expanding practitioners' training and ensuring ongoing support for is very essential, in maintaining and refining these effective methods in various healthcare, setting. And again, future recommendations is that different approach with larger and diverse samples and mixed method approach be implemented studies that will eventually validate and extend the study findings. um Before I go to any questions, I will say that this program for DNP program has really impacted my life in so many ways, both personal and professional means. It has guided and equipped me in making the appropriate and the right decision in leadership. When it has to do with research, right questions, and improvement in the patient care. It has guided me in my confidence in addressing things that has to do with patient care in this healthcare system that continually evolve. Thank you so much. Any question? So these are my references to this project. And thank you everyone for making this process a success for me. I will forever appreciate this journey. It has changed a lot in my life. Thank you so much and have a blessed day.